Excuse me, may I? Yeah. Tech neck is real. Hi, I'm Dr. Azizzadeh, and today we are going to talk about the tech neck. So please tune in and subscribe and comment and like, because today we're going to talk about a super interesting issue. Welcome to the center. My name is Dr. Babak Azizzadeh. I'm a facial plastic surgeon that specializes in facelifts, facial reanimation, and rhinoplasty, located in Beverly Hills, California. Here, we talk about all things facial plastic surgery. Welcome to the channel.
So, Dr. Azizzadeh, what is tech neck?
So tech neck basically is a terminology that we've started using because people are now on their screens so much at the coffee shop, while walking, at school, at home, work. And basically for a long time we didn't really pay attention a lot to the neck until it got really, really bad. But now, because everyone that we see all the time, they're bending and turning and bringing their neck down, it's becoming really, really obvious. So we term it the tech neck. So like this is a perfect example. Beautiful woman, early signs of aging, but when she starts bringing her neck down the way that we're holding devices, look at how much redundancy and pleating of the neck skin. So that's a problem that now we're noticing a lot more. Again, 20 years ago, 15 years ago, we weren't paying that much attention to it. Now, this neck issue is a big, big problem. So how do we manage tech neck? It really depends. For patients in their 30s and there isn't a lot of heaviness to the neck or a small chin, we can utilize energy-based devices, non-surgical treatments to just tighten up the neck and keep the skin with good elasticity. But as we get older and the neck elasticity is not as much, then we'll have to deal and manage more surgically. And the surgery needs to be done very, very specifically because this requires the muscles in the neck to be tightened deeply, and for us to do a deep plane face and neck lift to kind of support the neck back here as well. That way, when they turn their necks down, it ends up becoming much more clear, less pleating. And this is a perfect example of someone you could see. Look at the before and look at the after. It's just nice and clean. The jawline is great. And this is an early result, maybe a month or so or 3 weeks out of surgery. But you could see look at that. The whole neck is really nice and it looks like a 20-year-old's neck and still very natural, doesn't look like there's been surgery.
How do you avoid tech neck?
I don't know if there's really a way to avoid tech neck because our lives have fundamentally changed over the past 10 years. The way that we communicate, the way that we conduct business, I think has changed. And as a result, it's not just, tech neck is not just that it's there. It's probably has always been there. It's just now more noticeable, more visible. So as a result, I don't know if there's a way that we can actually prevent it from happening, but we can certainly, I would say, maybe slow it down by utilizing some of the energy-based devices and being a little bit more cognizant of the way that we're holding devices. And that really holding devices in a more better posture actually will help our neck, our pain, the entire way that we posture ourselves. And that, I think, is a great thing as well.
Can you talk to us about aging and how that affects the neck?
So the aging process of the neck is pretty complex. Obviously, we have skin. Skin is the coverage of the neck. And as we age, the elasticity of the skin changes. That's based on a lot of different factors. It's genetic, sun exposure, environmental, the amount of redundancy that we can have. But then deep to the neck skin is muscles. We have a muscle called the platysma. Then we have these fat compartments. Then we have these glandular compartments. Some people have a very small recessed chin and very heavy jowling. That can go over and make the neck contour look not as ideal. So the aging process in the neck area is we get more laxity of the skin. We get glands that start descending down. We get fat accumulation right in the center. And the chin bone and the jawbone also resorb. So as a result, this area becomes heavier, more loose, and that's why the neck becomes one of the most common areas that people get bothered with as they age. I think today we've talked about tech neck ad nauseum, but bottom line is, really we need to, change perhaps some of the way that we're ergonomically holding ourselves. Thank you so much for watching this video. I hope you have been able to learn something. I hope you've been watching this with your screen up. And comment below. Send us photos if you feel like your neck is experiencing the tech neck. And we look forward to seeing you soon. And please follow all our social media, our Instagram and YouTube channels.